Human immunodeficiency viruses, HIV, are a group of retroviruses that infect humans and weaken the immune system, leading to a condition called acquired immunodeficiency syndrome, AIDS. There are two main types of HIV, HIV-1 and HIV-2. HIV-1 is the most common and widespread type of HIV globally, while HIV-2 is primarily found in West Africa. Both types of viruses are transmitted through certain body fluids, including blood, semen, vaginal fluids, and breast milk. The most common modes of transmission include unprotected sexual intercourse, sharing contaminated needles or syringes, and transmission from an infected mother to her child during pregnancy, childbirth, or breastfeeding. Once a person becomes infected with HIV, the virus attacks and destroys CD4+ T cells, which are a crucial component of the immune system. As the number of CD4+ T cells declines, the immune system becomes compromised, making the individual more susceptible to various opportunistic infections and certain types of cancers. HIV infection progresses in stages. The initial stage is acute HIV infection, which may cause flu-like symptoms, such as fever, fatigue, sore throat, swollen lymph nodes, and rash. After the acute stage, HIV enters a chronic phase characterized by a long asymptomatic period, during which the virus continues to replicate and gradually weaken the immune system. If left untreated, HIV infection can progress to AIDS, which is diagnosed when the individual's CD4+ T cell count falls below a certain threshold or when specific opportunistic infections or cancers develop. AIDS is a severe condition where the immune system is significantly compromised, and the person becomes susceptible to life-threatening infections and diseases. While there is currently no cure for HIV/AIDS, advances in medical treatment have led to highly active antiretroviral therapy, HAART. HAART involves a combination of antiretroviral drugs that can suppress viral replication, slow the progression of the disease, and help individuals with HIV lead longer and healthier lives. Additionally, preventive measures such as practicing safe sex, using clean needles, and accessing antenatal care and interventions can reduce the transmission of HIV. The symptoms of human immunodeficiency virus, HIV, can vary depending on the stage of infection. It's important to note that some individuals may not experience any symptoms at all, especially during the early stages. However, when symptoms do occur, they may include acute infection, primary HIV infection, fever, fatigue, sore throat, swollen lymph nodes, rash, muscle and joint aches, headache, nausea, night sweats. Asymptomatic stage, chronic HIV infection. Many people with HIV do not experience any specific symptoms during this stage, which can last for several years. However, the virus continues to replicate and progressively weaken the immune system. Symptomatic HIV infection. As the immune system deteriorates, individuals may experience persistent or recurring symptoms, including fever, fatigue, swollen lymph nodes, weight loss, diarrhea, night sweats, recurring infections, such as respiratory or skin infections, oral thrush, white patches in the mouth, oral or genital ulcers, shingles, painful rash, pelvic inflammatory disease, PID, in women, menstrual irregularities in women, advanced HIV infection, AIDS. When the immune system becomes severely damaged, individuals may develop AIDS-related complications, which can include opportunistic infections, example, pneumonia, tuberculosis, candidiasis, cytomegalovirus. Cancers, example, Kaposi's sarcoma, lymphoma. Wasting syndrome, unexplained weight loss and muscle atrophy. Neurological symptoms, example, memory loss, confusion, neuropathy. Recurrent fever and night sweats. Chronic diarrhea. Severe fatigue. Human immunodeficiency viruses, HIV, are caused by infection with either HIV-1 or HIV-2. These viruses are primarily transmitted through specific body fluids, including sexual transmission. The most common mode of HIV transmission is through sexual contact, particularly unprotected vaginal, anal, or oral sex with an infected partner. The virus can enter the body through small tears or abrasions in the genital, rectal, or oral mucous membranes. Blood transmission. HIV can be transmitted through direct contact with infected blood. This can occur through sharing contaminated needles or syringes during injection drug use, accidental needle stick injuries in healthcare settings, or receiving contaminated blood transfusions or organ transplants, though this is extremely rare in countries with strict screening measures. Mother-to-child transmission. HIV can be transmitted from an infected mother to her child during pregnancy, childbirth, or breastfeeding. However, with appropriate medical interventions and treatment during pregnancy, the risk of mother-to-child transmission can be significantly reduced. The treatment of human immunodeficiency virus, HIV, involves the use of antiretroviral therapy, ART. ART is a combination of several antiretroviral drugs that target different stages of the HIV life cycle, aiming to suppress viral replication, reduce the viral load in the body, and preserve immune function. Here are some key points about HIV treatment. Initiation of treatment. HIV treatment is generally recommended for all individuals living with HIV, regardless of their CD4+ T cell count or clinical symptoms. Early initiation of treatment leads to better health outcomes and reduces the risk of transmitting the virus to others. Antiretroviral drugs. ART consists of a combination of 3 or more antiretroviral drugs from different classes. These classes include nucleoside reverse transcriptase inhibitors, NRTIs, non-nucleoside reverse transcriptase inhibitors, NNRTIs, protease inhibitors, PIs, integrase strand transfer inhibitors, INSTIs, and entry/fusion inhibitors. Treatment adherence. Adhering to the prescribed ART regimen is crucial for the effectiveness of treatment. It is recommended to take antiretroviral drugs consistently and as prescribed, without missing doses. This helps to maintain viral suppression and prevent the development of drug resistance. Monitoring and follow-up. Regular monitoring is essential to assess the effectiveness of treatment and overall health. This includes routine viral load testing to measure the amount of virus in the blood and CD4+ T cell counts to monitor immune function. Additional laboratory tests and clinical assessments are also performed to monitor potential side effects or complications. Treatment as prevention. Effective HIV treatment not only improves the health of individuals living with HIV but also plays a vital role in preventing HIV transmission. When HIV is suppressed to undetectable levels in the blood, known as viral suppression, the risk of sexual transmission is greatly reduced.